Welcome to the Senior Techie Podcast. At a recent medical tech conference over in Atlanta, researchers confirmed something that's honestly quite startling.
Yeah, startling is the right word for it.
Right. They found that a prolonged lack of human connection, like real human connection, is actually as dangerous to your physical body as smoking 15 cigarettes a day.
Wow. I mean, when you hear it put like that, it really stops you in your tracks.
It does. And today, we're looking at the controversial and frankly somewhat surprising new tools that are being built to try and fix that.
It really is a staggering statistic, you know? We
Right.
spend this massive amount of time worrying about our diet or getting enough exercise or checking our cholesterol.
Oh, absolutely. Taking all the vitamins.
Right, but isolation is this silent epidemic. And the medical community is, well, they're finally treating it as a structural health crisis.
And that's exactly why we're here today. I mean, if you are listening to this right now, maybe you're a senior who is interested in using all this new technology, but you're feeling a little afraid that you've been left behind.
Which is such a common feeling.
Completely common. Or maybe you're a caregiver, right? Or a family member who's just trying to navigate this dizzying world of digital health portals for a loved one.
And it is dizzying. I mean, the passwords alone.
Oh, don't get me started on the passwords.
Yeah.
But look, you might not know the entire techie vocabulary yet, and you might feel like the digital world is just spinning way faster than you can track.
Yeah, but here's the thing you have to remember. You have decades of life experience, you know? You have spent a lifetime solving complex, real-world problems.
Exactly. Navigating a smartphone or a digital portal.
Yeah.
That is entirely within your grasp. It really is.
It truly is. I always say that the intimidation factor, it's often a failure of the engineering, not a failure of your capability.
Well, that's such a good point.
Right. Tech companies have historically been just terrible at explaining their tools to everyday people. But once you understand the basic mechanisms, you realize these are just tools. It's really no different than learning the dashboard of a new car.
That's exactly it. And we are here to be that patient, deeply knowledgeable friend sitting right next to you at the kitchen table. The Senior Techie is all about helping you navigate these waters comfortably.
Not to empower you.
Exactly. Empowering you to take full control of your digital life. And to do that today, we are looking at a massive stack of sources, articles, keynote speeches, you name it, all from the American Society on Aging 2026 conference.
Yeah, that just took place recently, right?
Right. It was April 20th to the 23rd at the Hyatt Regency in Atlanta.
Now, I know a professional industry conference in Atlanta might sound, well, a bit disconnected from your daily routine sitting in your living room.
A little dry, maybe.
Yeah, a little dry. But this was a massive gathering. We are talking about the policymakers, the healthcare advocates, and the major tech engineer.
The people pulling the strings.
Exactly. The people who are actively making decisions that will quietly, but very surely, show up in your doctor's office in the coming months.
So our mission today is to essentially sift through those thousands of pages of reports and panels. We want to extract the most practical, truly useful takeaways from this massive event for you.
Cut through the noise.
Right. Cut through the noise so you can stay independent, informed, and most importantly, completely confident in using what's coming next. Okay, let's unpack this.
I think we should probably start with the overarching theme of the entire Atlanta conference, because surprisingly, it actually wasn't about microchips or touch screens or even artificial intelligence.
Which you'd expect at a tech conference.
Right. But the official theme was actually the power of belonging.
Okay, let me stop you right there, because that sounds like, well, it sounds like a very nice feel-good corporate retreat slogan.
It does. It sounds a bit fluffy.
Yeah. What does belonging have to do with hard medical technology?
I know it sounds fluffy, but the medical data backing it up is just undeniable at this point. When the experts in Atlanta talked about belonging, they weren't talking about a feeling. They were talking about clinical intervention.
Like a medical treatment.
Exactly. They highlighted the serious medical recognition that isolation, true disconnection, is actively making older adults sicker.
But wait, isn't slowing down and, perhaps seeing fewer people just kind of a natural part of aging?
Right.
Why is the medical community suddenly treating it like a disease we need to cure?
Well, it comes down to evolutionary biology. It's about how our bodies process stress. Think about it. Thousands of years ago, if you were isolated from your tribe, you were in immediate physical danger from predators.
Oh, sure. You're out in the wilderness alone.
Right, so your body adapted to that by triggering this continuous low-level state of fight or flight whenever you were alone.
Interesting.
Your nervous system essentially pumps out a stress hormone called cortisol. And over time, high cortisol actively suppresses your immune system, it raises your blood pressure, and it can even accelerate cognitive decline.
Wow. So social connection isn't just a nice weekend activity.
No, not at all. It's a biological requirement for a stable, healthy nervous system.
Well, that completely reframes the issue. Think of your health like a house, right? Medicine and a good diet, those are the roof and the walls. But social connection, that is the concrete foundation.
I love that analogy.
Without the foundation, the house isn't stable. But, if connection is the biological requirement here, I have to be a little skeptical about the tech industry's role.
That's fair. They haven't had the best track record.
Right, because for years, their idea of elder care technology was to, slap a plastic panic button on a lanyard around someone's neck and just call it a day.
The old I've fallen and I can't get up approach.
Exactly. So what makes this conference different? If connection is the foundation, how are aging service organizations actually building tools to keep people connected rather than isolated behind screens?
Well, if we connect this to the bigger picture, the reality is that tech companies are finally having their feet held to the fire by insurance companies.
Follow the money.
Always. Insurance providers will no longer pay for these flashy tools that don't actually improve long-term health outcomes. So the shift they discussed in Atlanta is moving away from simply monitoring older adults.
Just tracking their steps or whatever.
Exactly. Moving away from that toward fostering real, meaningful engagement. They are building these highly simplified platforms that allow you to easily find local groups or connect with family via video interfaces that don't require a master's degree in computer science to operate.
Which is a relief, because if loneliness is creating a physical health crisis, the immediate challenge for doctors is intervention, right? I mean, how do you treat a patient whose primary symptom is that they physically struggle to leave their house to come see you?
And that's exactly why the conference pivoted so heavily to things like the electronic medical record and telehealth.
Yes, the health tech was definitely a dominant thread there. But before we get into the weeds of how these systems are actually changing, we really need to clear up the vocabulary.
Definitely. There's so much jargon.
So much. Let's define the jargon with some real-world analogies. The first term you will hear constantly is telemedicine or telehealth.
They use those pretty interchangeably.
Right. So think of telemedicine as the modern version of an old-fashioned doctor's house call. Instead of the doctor carrying a little black bag and driving to your front door, they use the window of your computer or your tablet screen to check in on you.
You're sitting comfortably in your favorite armchair.
Yes, you're in your armchair, they're sitting in their office, and you can see and hear each other perfectly through the screen.
It's brilliant because it saves you that stressful drive across town. You don't have to hunt for parking, and you get to avoid the waiting room full of folks who might be coughing with the flu.
That alone is worth it. Now, the other major term is wearables. You'll hear about wearable devices a lot.
Oh yeah, they are everywhere now.
Think of these like a continuous tiny blood pressure cuff or a miniature heart monitor that you wear just like a wristwatch. It quietly pays attention to your body's signals, like your pulse or how many steps you take, while you simply go about your day.
Now, the reason the tech industry failed older adults so badly with these types of tools in the past is really an issue of design friction.
What do you mean by design friction?
Well, for a long time, these engineers out in Silicon Valley were building apps for 25-year-olds, and they simply scaled the font sizes up, assuming that making the letters bigger was enough for seniors.
Which completely ignores how our bodies actually change as we age.
Precisely. For instance, they didn't understand that older users interact with touch screens differently.
Oh, I've noticed this.
Right. Touch screens on a tablet or a smartphone, they don't actually operate on pressure. You don't push them like a physical button. They rely on electrical conductivity from the natural moisture in your fingertips.
Oh, wow. I didn't know that.
Yeah. And as we age, our skin naturally loses moisture. So an older adult might tap a screen perfectly right where the button is, but because of the dry skin, the tablet just doesn't register the tap.
So the user naturally assumes they broke the machine or they just don't know what they're doing.
Exactly, when in reality, it's not their fault at all. It's a hardware design failure.
That is fascinating and honestly incredibly validating for anyone who has ever sat there and fought with a frozen tablet screen. It's not you, it's the conductivity.
It really is.
So how is the industry finally fixing this?
The massive shift highlighted at the conference is that tech companies are now working directly alongside clinicians and alongside aging service organizations. They are finally embracing something called inclusive design.
Okay, inclusive design.
Yeah. This means creating screens with much larger touch targets, higher contrast colors for aging eyes,
Hmm?
and greatly simplified menus. They are finally recognizing that the burden of making technology easy belongs to the engineers, not to you, the user.
So what does this all mean? Well, it means the technology is finally maturing to a point where it works for you rather than you working for it.
Exactly.
And because of this, you have a great opportunity to get ahead of the curve comfortably. If your doctor's office offers telehealth visits, our actionable advice for you today is to try booking a routine, everyday check-in using this technology now.
Oh, I cannot stress that enough. That is such good advice. Please do not wait until you have a nasty flu or a sprained ankle and you're feeling miserable to try and figure out how the computer camera works.
Oh, that sounds like a nightmare, trying to remember your password while you have a fever.
Exactly. Get comfortable with it when the stakes are low.
Right, just a standard prescription refill checkup.
Yeah.
Learning how to click the link, adjust your volume, and just chat with your doctor through that screen when you're feeling fine, it puts you in control of the learning curve.
Now, there is a reason these seamless telehealth systems are suddenly possible without constantly crashing the doctor's computer servers. And it's because of a new engine running in the background. It gets a massive amount of press, and it was definitely the elephant in the room at the Atlanta conference.
We are, of course, talking about AI or artificial intelligence. And again, let's banish the jargon here and, frankly, banish the sci-fi movie nonsense.
Yes, please. No Terminators here.
Exactly. Imagine AI as a highly organized, lightning-fast file clerk in your doctor's back office. It absolutely does not replace your doctor's medical degree or their judgment.
It's an assistant.
A super fast assistant. It instantly pulls your massive medical file. It cross-references a global database to flag if a new medication might interact with something you already take. And it neatly schedules your next visit without putting you on hold for 20 minutes.
That is a perfect distinction. In healthcare, we are dealing with what's called narrow AI, which is simply software designed to do one specific administrative task incredibly well.
Okay.
And at the age tech stage at the Atlanta conference, this was the main event. They had heavy hitters there, companies like OpenAI and Surf Robotics, sitting on these panels discussing how to integrate this safely for older adults.
I have to admit, I would expect a panel with OpenAI at a tech conference to just be them, I don't know, showing off a machine that folds your laundry and cooks your breakfast.
Right, the flashy stuff.
Or, conversely, I worry about those headlines where AI, quote-unquote, hallucinates or just makes things up. I mean, do I really want a computer hallucinating my medical chart?
And that is a very valid fear. But what's fascinating here is that the biggest tech companies in the world were explicitly telling the audience of healthcare providers to take baby steps.
Really? Big tech saying slow down?
Yes. They pushed back against the flashy robotic gimmicks. Their advice was incredibly blunt. Start with mundane, practical problems. They aren't pushing for AI to diagnose your illness. They are pushing for AI that simply listens to your doctor's appointment and automatically transcribes the notes.
Okay, wait, explain how that actually works in the examination room. Because usually my doctor spends half of my 15-minute visit staring at a laptop screen, typing furiously to keep up with the insurance paperwork requirements.
And that completely ruins the human connection we established as vital earlier in the show.
It really does. You're talking to the back of their head.
Exactly. But with an AI medical scribe, the doctor just looks you in the eye and talks to you normally. The software securely listens to the conversation, it understands the complex medical terminology, and it types the chart up perfectly in the background.
That's incredible.
It automates the paperwork so the human beings, your nurses and doctors, have more time to actually care for you.
That is a massive paradigm shift. It's using technology to get the technology out of the way.
Exactly.
So how do you, the listener, actually interact with this?
Well, the actionable advice here is beautifully simple. At your next doctor's visit, just ask them.
Yep, just ask.
Ask the front desk or your physician, are you using any AI-assisted tools to manage my scheduling or my care.
You have every right to know how your data is being handled. And simply asking the question kind of brings the wizard out from behind the curtain.
Yep. You might be surprised to find they already use a smart AI system to manage your prescription refills. And it's been working seamlessly for you for months without you even noticing.
Now, all of these amazing tools we've discussed today, the telemedicine house calls, the AI file clerks, the online community programs helping build that foundation of belonging, they all rely on one absolutely crucial piece of infrastructure.
The pipeline.
Right. If you don't have this or if you feel unsafe using it, literally none of the previous topics matter.
You're talking about the internet connection.
I am. Let's define the final piece of jargon for today. You hear the word broadband thrown around by politicians constantly.
Always during election years.
Always. Think of broadband like the plumbing pipes bringing water into your house. If you have an old, narrow pipe, the water, or in this case, the internet information, barely trickles in.
And that trickle is what causes the problems.
Exactly. That's when your video call freezes or a web page takes 5 minutes to load. Broadband is simply the wide, modern pipe that lets massive amounts of data flow smoothly, constantly, and quickly into your home.
And the conference actually dedicated an entire session to what the panelists called the three-legged stool of broadband adoption, because fixing this plumbing issue isn't just one single problem.
Okay, what are the three legs?
The three legs are access, barriers, and actual use.
Let's break those down. The first leg is access. Does that wide pipe even reach your town? If you live in a rural area, the answer might still be no.
Unfortunately, yes.
The conference specifically highlighted regions like Western North Carolina to point out that real physical gaps remain.
Because laying fiber optic cable costs tens of thousands of dollars per mile. In a major city, that 1 mile of cable might cover 500 paying homes.
So it makes financial sense for the company.
Right. But on a rural mountain road in North Carolina, it might only cover 3 homes. The economics just don't work for the internet companies without policy intervention. So the policymakers in Atlanta acknowledge that local voices from these rural areas need to be in the room making decisions, not just having solutions dictated to them from a city hundreds of miles away.
So that's the first leg, access. But let's say the wide pipe is there and it's securely connected to your house. Having the connection isn't enough if you don't know how to turn the faucet on. Which brings us to actual use.
Exactly. Many older adults actually have sufficient internet access, but they lack the confidence to use it fully.
Right. They have the iPad sitting on the coffee table, but they don't touch it.
Yeah, they might feel overwhelmed by a confusing menu, or they might be terrified of pressing the wrong button and somehow breaking the entire machine.
Here's where it gets really interesting. The experts in Atlanta recognized that the solution isn't just laying more cables in the dirt. The solution is community education.
Yeah.
We cannot just hand someone a tablet,
Yeah.
say good luck and walk away. We have to provide the training and the reassurance to use it.
So true. If you are sitting there listening and realizing that you have been avoiding certain online tasks, maybe setting up an online bank account or logging into that patient portal we talked about because it feels confusing or you're worried about doing it wrong, please know that help is out there.
And it's usually entirely free.
Yes, free help.
Your local public library is a fantastic resource for this. Most libraries have free digital literacy programs or tech help hours where a real person will sit with you one-on-one and walk you through whatever you're trying to do.
They are so patient, too.
They're the best. Also, I highly recommend visiting aarp.org. They have wonderful free tech training designed specifically for older adults. And of course, right here at the Senior Techie, providing these resources to bridge that digital gap is exactly what we do.
But, we also have to address the third leg of that stool, the barriers. And one of the biggest barriers keeping older adults offline isn't confusing menus. It is safety. The fear of financial scams.
It is a very real, very valid fear. The flashing pop-ups warning you of a virus, the emails that look exactly like they are from your bank but aren't, it can feel like walking through a minefield.
It really can. Scammers are highly sophisticated now.
They use tactics like phishing, which is the digital equivalent of a criminal putting on a fake delivery uniform to trick you into opening your front door. The conference in Atlanta didn't shy away from this at all. They addressed the growing concern of elder fraud head on.
And this raises an important question. As society pushes more and more of our daily lives online, from banking to healthcare to socializing, how do we ensure that our most vulnerable populations aren't left holding the bag on cyber fraud?
The answer starts with knowing exactly where to turn if you feel something is suspicious or if you accidentally click something you shouldn't have. And listen to me. There's absolutely no shame in being tricked by a sophisticated scam.
None at all. It happens to highly trained cybersecurity experts.
It happens every day. The specific resource flagged at the On Aging 2026 conference for this is the FBI's Internet Crime Complaint Center.
Right. If you encounter a scam, or even just suspect one, you can report it directly to them at ic3.gov. That's the letter I, the letter C, the number 3.gov.
Write that down and put it on a sticky note next to your computer. Having that resource empowers you. You aren't defenseless. And remember, staying safe online is often just about pacing yourself.
You don't have to rush.
Exactly. You don't have to click a link immediately. You don't have to answer an urgent-sounding text message right away. Take a breath, verify the source, and use the resources available to you.
You are in control of the pace. The unifying thread through all of this, straight from the researchers and engineers down in Atlanta, is that these tools are finally being redesigned to work for you, to foster your independence, and to ensure you remain connected to your community.
Before we go, I want to leave you with one provocative thought to mull over. We talked heavily today about taking baby steps and strategic adoption. So what is one piece of technology? Maybe it's a smartwatch someone gifted you that's currently sitting in a drawer. Maybe it's a grocery delivery app on your phone. Or maybe it's that online patient portal your doctor keeps mentioning that you've been putting off trying because it just felt like too much hassle.
We all have at least one.
We do. What if you tried it this week? Just a low-stakes experiment. You don't have to master it in a day. Just open it up, look around the menus, and remember that you are deeply capable of mastering it. This podcast was brought to you by The Senior Techie. It's available on Apple Podcasts, YouTube, and Spotify. If you'd like to receive their free newsletters, you can subscribe at subscribe.theseniortechie.com.